Hello everyone, I'm Dr. Neha Gupta from Mediworld Fertility, New Delhi. Today we are going to talk about fertility preservation, what it means and who needs it. So fertility preservation means we are preserving your egg and sperm and we are using it for future purpose, for reproductive needs. So what are the indications? Any patient who has cancer, who needs chemotherapy or radiotherapy can opt for fertility preservation because these drugs or radiotherapy can cause damage to your gonads and your future fertility can be compromised. So before you start your chemotherapy or radiotherapy, please meet the fertility specialist, preserve your sperm or your egg and then go forward and do your treatment. Other cases like benign cases where we have chronic conditions like endometriosis. Those patients also, young girls who are coming with recurrent endometriosis can opt for fertility preservation because their egg reserve and egg quality gets compromised because of repeated surgeries and repeated cyst formations. So there are certain couples like same-sex couples, LGBTQ couples who also would need fertility preservation. So because of the same-sex problem, if they want to have children, we can use their sperm or their egg, and by the help of IVF with one donor gamete, be it the egg or be it the sperm, we can form their embryo and transfer either in self if it is a lady or in surrogate if it is a male. So cryopreservation, fertility preservation can be done for same-sex couples also. Other people who would need fertility preservations could be because of social reasons. So some people, they have their financial problems, they have their other career-related problems or their family problems where they cannot bear children for now, but they want to bear children in the future. But because of the biological clock which cannot be reversed, if they opt for fertility preservation well within time, we can freeze their egg and sperm, and whenever they are mentally and physically ready, we can form the embryo by the help of an IVF and we can transfer in the uterus. So fertility preservation can also be done if you are not prepared for now, but you want to bear children in the future. How is it done? So now we are doing vitrification. So vitrification is the technique by which we are freezing the egg and the sperm. Sperm freezing is very simple. We just take an ejaculated sample after doing your basic screening, and after taking the sample we prepare it, and with the help of sperm freezing media we put it in liquid nitrogen in multiple vials. So based on the semen volume we can even do multiple 4, 5, 6 vials also we can freeze for future use. For egg preservation, we do all your basic workup. We do all the tests that are needed, the ultrasound, we analyze how many oocytes we are seeing, what is the antral follicle count. Based on that, we give you gonadotropin injections, which are simple injections which can be self-administered, which are just like insulin, which are put on the skin. So those injections the patient takes for about 10 days, and 12th day we retrieve those oocytes under short anesthesia. So it's absolutely pain-free. You will not have any problem. You will not have to get admitted in the hospital. It's a daycare procedure. Once we take out the eggs, we check the maturity of the egg and we freeze it in multiple leaves. So based on the number of mature oocyte, we can give you multiple chances for egg freezing. Now this is done by vitrification, which is a fast freezing method, and once the egg is frozen, it is put in liquid nitrogen at -195 degrees. Once we freeze the egg and sperm, we can keep it for as long as we want. So we have to just maintain those containers. We ask you to give signatures, you have to give for every year, and yearly we can renew the contract for egg and sperm freezing. And whenever you want, we can thaw them, we can bring them to room temperature and form the embryo by the help of your frozen gametes, and we can transfer in your uterus. This is how the egg or sperm preservation is done. It is absolutely simple. Please do not get scared. If you have any questions regarding egg or sperm freezing, do not hesitate to ask us. We are absolutely available. You can call us, you can come and meet us. I hope you like this video. Please share, subscribe, share it with your friends, share it with your family, share it with people who probably are thinking of egg or sperm preservation but are reluctant to do it. Thank you so much.